There's a misunderstanding I think a lot of people seem to have about AI in medicine, and to a lot of doctors the discussion around this feels a bit strange, and frankly I blame Dr. House. There are many applications of AI in medicine with the real potential to help, but the one that everyone tends to focus on is diagnosis, and the idea that an immensely powerful algorithm with access to the entire body of medical literature and enough computing power to poison the water supply for half the state of Virginia could perform better than a single human being is not especially surprising to me. But the thing is that making a diagnosis is, I don't know, about 5% of my job. I did a ward round today, it's Sunday, and the hospital is just full of frail elderly patients with at least 5 separate problems, all contributing to their clinical state. This is something called multimorbidity, and it's rapidly on the rise the world over. For my ward, this would look something like heart failure, diabetes, high blood pressure, cholesterol, obesity, kidney disease, lung disease, and perhaps something that's tipped them over the edge into hospital like an infection. And AI wouldn't help me on unifying a diagnosis here, nor on deciding treatment either, because treatment for one condition often exacerbates another, so you have to cautiously titrate things anyway, and every patient responds differently in an unpredictable way. And it's a real shame that the public perception of us sitting around with our thinking caps on trying to get to the bottom of some diagnosis is inaccurate, because many of us went into medicine because we love that intellectual challenge of figuring out a puzzle. Dr. House, who I mentioned, who was obviously based on Sherlock Holmes, written by a doctor, inspired by another doctor, but that was 150 years ago. Today, with an aging population and rising multimorbidity, we don't see these elegant single explanations like you get in an episode of House. We see a constellation of overlapping diseases, drug interactions, and social problems that no one algorithm can ever capture. So as I went round the extremely complex patients today, doing what feels more like spinning hundreds of plates, the idea that some diagnostic AI will offer me much help feels a bit like pie in the sky. And all right, you say I'm a specialist, but maybe even if we take doctors on the diagnostic front line, like a GP or an emergency doctor, the majority of their job is now managing chronic conditions and making decisions about care, not puzzling over new and mysterious diagnoses. My group chats light up when we have some interesting or challenging diagnosis. The days when we can flex that diagnostic muscle and ponder something and really feel like a doctor are highlights, but they are few and far between, sadly. Media stories where a mother spends years searching for her son's diagnosis and then discovers a rare amino acid malfunction are exactly that, rare. That's why they make news stories. It's a million miles away from the reality of medicine and where the biggest pressures exist on health systems around the world.